Hello, guys. Where is everybody? How many are we here? Let me see. Hello. We are 6. Okay, let's wait for us to get to 20. Let's give them 5 minutes. Hello. Anna, welcome. Darling. Chaperone is here. No Jamaican today. Hey, you're still thinking about this Jamaican. No Jamaican today. Okay, we are 11. Chanel, welcome. Welcome. Karinam 3802. Hello. Christine. Okay, we are getting to how many? Let me see. We are not 13. We need everybody here. Tell them to come online. $14. I'm already sorting your questions. So they have to come online quickly. We don't have much time. All chapters. Hello. Oh boy. Okay, so I don't think I should continue waiting for the others. I want us to jump into what we need to do today. So there are 3 chapters I want us to review today. We have the lymphatic system and immune system. We have the respiratory, and we have the urinary system. Just a moment. So let me share my screen. Okay. So as we are waiting for the others to be here, let's I should remove this thing. Am I better with the cap or without the cap? Which one? Tell me. With the cap or without the cap? Which one is better? Or like this? With the cap. Okay, fine. With the cap, front or back? Front. See front too. Somebody's laughing. Or back. Okay. Gabby said front. Oh, Gabby's gentle. Let me see. Anna said front. Okay, Anna was the first person on live today. So I'll put it front. Okay. Good. All right. So guys, okay. All right. So guys, I just want to give a very brief review of this lymphatic system, because some people texted me that they have a very difficult time understanding, what it's about. All right. So I'm not teaching. I'm just giving a very short recap. All right. So we know what the lymphatic system is. It's more like it helps to mop up the system and also to checkmate the system. All right. It imbibes itself with the immune system, and the immune system is not just an organ but a cell population that inhibits all organs and defends the body from agents of disease. So when you are mentioning, the body organ system, you can't call immune system as an organ system. Circulatory system is an organ system. Urinary system is an organ system, but immune system is not an organ system. Instead, the immune system composes of group of cells, right, that are embedded in every other structure. And what is their function? Inspection for disease agents, activating responses, mopping up their genitouria, right? Like they return fluid to the bloodstream. Extremely important that you guys understand these things. You feel me? So this is more like an intro to this thing, the lymphatic system. What do? They recover fluid. I told you their genitals. Immune system, lipid absorption using their lacteals. All right. So this is a description of lacteals and others. All right. These are the things that they use. They use the lymph. Yeah, you need to know about the lymph, the lymphatic vessels, the lymphatic tissues, and lymphatic organs. Front. Okay. You need to know about the lymph. The lymph is that fluid that they mopped up. Lymphatic vessels is the transportation of that fluid, and lymphatic tissues are aggregates of lymphocytes and macrophages that populate many other organs. Then we have now the lymphatic organ itself, which defends. All right. So for people that don't understand the lymphatic organ, you need to know what the lymph is made up of. I'm not going to teach it. You need to know about the lymphatic capillaries. Extremely important. Now I'm jumping. So, like when we did vessels, arterial vessels and venous vessels, we discussed their layers. All right. They still have almost exactly the same layer: tunica interna, tunica media, and tunica externa. That's the same thing that lymph has. The lymphatic vessels. Look at it. The lymphatic vessels, exactly the same thing. If you look at the histology, you will understand what I'm talking about. Now, the vessels, we talked about the 6 lymphatic trunks and 2 collecting ducts. The lymphatic trunk, you can get it in different places, all right? The jugular, the subclavian, the bronchomediastinal, the intercostal, the intestinal, and the lumbar. Do you understand? You can get it all these places. And this 6 lymphatic trunks, right? They use 2 ducts, 2 specific ducts, all right? Which is the right lymphatic duct and the thoracic duct. So you need to know where the right lymphatic duct collects from and where the thoracic duct collects from. It's just like you saying, oh, in this big building, I employed 2 janitors. You feel me? One of the janitor is right lymphatic duct janitor. The other one is left lymphatic. The other one is thoracic duct janitor. You feel me? Then somebody is asking you, oh, you have 2 janitors. What do this one do? What do this one do? You say, this one mops 1, 2, 3, 3 left. This one mops every other place that this one does not mop. That's just how it is. All right. So you need to look at it properly so that you'll be able to understand it. This is the lymphatic system proper. For people that don't understand it, you need to take a critical view of it because I'm not explaining it. This is for the axillary region, the thoracic region rather. All right. The one that drains the breast and its surrounding tissues. This is the lymphatic, the axillary area. That's the armpit area. All right. So things sometimes moving through this lymphatic this thing and drain into the blood like cancer. All right, that's one of the reasons why we are studying them. So this is the flow of lymph. You need to know the flow of lymph, how it flows from where to where to where to where. And also you need to know about the valves because valves prevent backflow. Valves prevent backflow. Now, when you're talking about the cell itself, the cell are things that the lymphatic tissue use. All right. For example, that janitor that we employed has a bucket, he has a cleaner, he has a packer, he has a broom, all right? All those things are what cells that he uses to accomplish his mission. So that's exactly what lymphatic cells are. Natural killer cells, T lymphocytes, B lymphocytes, macrophages, and what else? What else do we have? Macrophages and what? I think there are 5. There are 5. Macrophages. I can't remember the 5th one though. But just know what they do. That's the most important one. Know what they do, each and every one of them. You understand? You have to know what they do. Okay, the dendritic cells and reticular cells, 6. Some textbooks will tell you 5, but it should be 6. All right. These dendritic cells are usually the ones that they are antigen presenting cells, APCs. That's what we call them. You understand? Antigen presenting cells. They are the ones that will carry the antigen. All right. That's the infection and present to the system and say, look at the infection, oh, kill it. You understand? Look at infection, kill it, and immediately present it. Who is it presenting it to? It's usually presenting it to what? The natural killer cells or even the T lymphocytes. All right? Then the natural killer cells, they will now destroy the bacteria, destroy the virus, destroy everything destroyable. All right? Why the T lymphocyte also does this, almost the same thing. But the most important thing about the T lymphocytes is where they mature, which is what? The thymus. Please remember that. So these are the tissue. We discussed the cells. These are the tissues. All right. We have the diffuse lymphatic tissue. Very important. Diffuse lymphatic tissue. All right. And we have the lymphatic nodules, which are the follicles. Then these are the lymphatic organs. We have the primary lymphatic organ. We have the secondary lymphatic. All right. So you need to know which one is primary, which one is secondary. They will ask you. Like primary is red bone marrow and thymus. Secondary is lymph node, tonsils, and spleen. You need to know which one is which. All right. Okay. So there are other things you need to know before I jump into the question. I don't want to teach, all right, because we don't have much time. Before you know it now, it's 3 hours. So you need to know what the thymus is. You need to know about the lymph node, the different lymph nodes. Why do you need to know about these different lymph nodes? Because you need to know where, like if a particular lymph node is inflamed. Let me give you an example. If the inguinal lymph node here, the inguinal lymph node is inflamed, I will know that there is something wrong in my entire lower limb. Does it make sense? Like the swelling tells us which area is having an issue. For example, if I have an abdominal lymph node inflamed, big, what is entering my head? It's telling me that, like all the abdominopelvic viscerals may be having issues, or one of them may be having issues. Like what? Like the urinary system, like the reproductive system. It has to make sense to you. I really want it to make sense to you. For example, if I have a swelling lymph node, sometimes your armpit swells up. That is a lymph node, axillary lymph node swells here. Then you're asking yourself, what? There is something wrong somewhere here. Maybe you have an injury here, and that injury is infected, and this lymph node is trying to, counter effect that injury, that infection. It becomes swollen. All right. So knowing the anatomical landmarks helps you to understand what is wrong with the patient. And remember, what we are doing is anatomy and physiology. What is anatomy? Location, location, location. What is physiology? Function, function, function. Or I can say that anatomy is what? Structure, structure, structure. Your ability to know the landmark will help you to what? To make proper diagnosis, especially for people that are preparing for NCLEX here. All right? Extremely important that you know that. All right? So these are abdominal areas. Lymphadenitis, lymphadenopathy. You need to know the difference between the two things. Adenitis is itis. Anything itis is inflammation. So swelling, painful node responding to what? Foreign antigen. Why, if you talk about lymphadenopathy, it's just a collective term for any lymph disease. All right? But adenitis is specifically to inflammation. Anything itis is inflammation. I keep telling you this. All right? You know about metastasis? That's how cancer travels. You understand? That's why you see, I don't know, somebody, a student was telling me that, the dad had a tumor on the leg, and is he a student? No, not a student. I think it's somebody from Nigeria, one of my former patients, that the dad had a tumor on the leg, but they took it, they thought it's a simple thing. That before you know it, the thing entered the lungs, bone marrow, brain. Do you understand? That's called what? Metastasis. When you discover it and they check it in the hospital, they do biopsy and they see that it is still within localized area, they can easily cut off that leg and that man will be alive. It's as simple as that. You understand? You try to cut it off before it enters the bloodstream, and that's exactly what we do when we see breast lump, breast tumor, or breast cancer. You understand? You try to avoid metastasis as much as possible to save your patients. All right? Then you talk about tonsil also. When you have tonsillitis, you have a tonsillectomy to remove it. All right? These are the main sets of tonsil: palatine tonsil, lingual tonsil, and pharyngeal tonsil. These are the locations. You look it up later. This is the histology of the tonsil. This is the spleen. These are what? Organs, lymphatic organs. This is the spleen that has the red and the white area. You understand? And when you cut the spleen open, everything is parenchyma. In case of it, they ask you. These are the functions of the spleen. You must know it by heart right now. Why I'm reviewing this thing is because when I'm asking you a question, I don't want you to open the slide. I want you to answer it as if you're in the exam hall. We are up to 20 people here. Those 20 people has to what? Respond. All right? Extremely important that you do that. Now, this is innate immunity. All right? A lot of pathogens, viruses, bacteria, fungi, there are lines of defense. We have the first line, second line, and third line. You must know what each line involves. Oh, in the exam, if they ask you, oh, the skin is what line of defense? You tell them first line of defense. All right? Then adaptive immunity is the third line of defense. Why? Because it has memory. It can remember that infection. Extremely important. All right? So this is where they classically differentiated the two of them. So you need to also understand that. Then now we are now discussing each barrier. All right? So I'm jumping that. This is the phagocytes. You need to know what phagocytes are. There are cells that engulf what? Foreign matter. Then you need to know what leukocytes are. Leukocytes are what? White blood cells. There are different types. We have the neutrophil, eosinophil, basophil, monocytes, and what? Lymphocytes. And that lymphocyte, we now have different types of lymphocytes. We have T lymphocytes that mature in thymus, and B lymphocytes that, they are B cells, all right? They are activated and they mature in the bone marrow. Extremely important. Yes, WBC, white blood cell. Thank you. All right? So these are different components of WBC. You look it up later. Then these are neutrophils. They're the ones that kill bacteria. You understand? Using phagocytosis. These are macrophages. And you have to remember that macrophages came from monocytes. Monocytes is a type of white blood cell. All right? So macrophages came from monocytes. You understand? They have two types of macrophages, the wandering and the fixed. You need to know what they do, all right, at your leisure. This is how they help in treating infections from a wound. Now, these are eosinophils. You need to know when we are thinking about eosinophils. For example, you do CBC for a patient and you see that eosinophils are elevated. What are you thinking? You are thinking about parasites. You are thinking about allergens. All right? So these are the things you are thinking about. All right? Now, when you are talking about basophils usually happen, at different times. All right? But in basophils, chemicals are secreted. And those chemicals, what do? They aid mobility and action of other leukocytes. So when basophil is secreted like this, it helps to carry others to where, or activate others, or carry them to the site of the injury. For example, if it's an injury. All right? For example, it has things that it secretes like leukotriene, histamine, heparin. All right? Heparin, so that the blood will not coagulate. Histamine, to cause vasodilation, to open way, to create way, to make the way bigger. And leukotrienes, we activate and attract neutrophils. Brim, neutrophil, come, there is an infection, come. That is leukotrienes. As all the neutrophil rush, boom, they may not be able to pass the way. What happens? Oh, let me give them histamine. Immediately they pour histamine and the blood vessel dilates. It gets bigger so that the neutrophils and the eosinophils can rush. You get it? And also the blood can coagulate and hold the neutrophils. So what happens? The heparin, it pours heparin so that blood will not coagulate. So these are the three major things it produces. All right? Aha. So extremely important that you guys know this, because they will ask you in your exam. You need to know about the lymphocytes. You understand? The TB and the NK cells. Extremely important. You need to know what they do. You need to know about interferon and complement system, which are very special antimicrobial proteins. What is the difference between interferon and the complement system? Interferons are secreted by certain cells, right, that are infected by specifically viruses. Specifically what? Viruses. And what do? They alert cells. Oh, there is a criminal around, though. Everybody lock up your door. Bakam. Chakam. That is what they do. Everybody locks up there. So they alert neighboring cells and protect them from becoming infected. They are protecting the neighboring cells. All right? Please close your door. There is a thief on loose. All right? Also, they help to activate. Immediately everybody closes their door to avoid being infected. They will go and activate NK cells and macrophages. And what does NK cells and macrophages do? Chakam, destruction of all those foreign materials that came. You understand? Immediately you call 911. NYPD, they come around and come and catch the person that is causing the nuisance. All right? This is the diagram that you need to understand. Complement system is different. Complement system is a group of 30 or more global proteins that make up innate immunity and adaptive immunity. Very, very important. They contribute to both innate and adaptive. And they are a group of 30. Group of 30 or more, but not less. They are produced in the liver. They circulate in the blood in an inactive form. They only become activated when they see a problem. All right? That's when they become activated. Do you understand? And what do? Inflammation, immune clearance, phagocytosis, and cytolysis. Extremely important. So what do you need to know for me and for your exam? You need to know, which one causes inflammation, which one causes immune clearance, which one causes phagocytosis, which one causes cytolysis. All right? You need to know what opsonization is. Extremely important. This is a diagram that helps you to understand it clearly. And this is a diagram that helps you to break it down more. Naturalization of opsonization and activation of complement system and pore formation. You need to know these things. All right? This is how complement system work. This is the classical pathway. This is the alternate pathway. And this is the lecithin pathway. All of them gets down to being activating C3A and C3B. Check it out. So C3A, this is the pathway. C3A causes inflammation if they ask you. While C3B causes immune clearance, phagocytosis, and cytolysis. Check it out. That's what. Nobody will start asking you these deep questions like C5B. No, that is when you are writing USMLE. You understand? United States Medical Licensing Exam. That's when they start asking you specifically, which one is C5B or C3B or C7B? Do you understand the point? But what you need to know at this level is that C3B causes three things: immune clearance, phagocytosis, cytolysis. C3b, C3a causes what? Inflammation. And that inflammation is extremely what? Important. All right? So you should remember that. And this is NK cell. This is NK cell. NK cell usually releases an enzyme known as what? Granzymes. Granzymes. And what does granzymes do? Granzymes will enter and perforate. You understand? Enter and perforate. Do you understand? And before you know it, it will destroy the organism. So it causes destruction. This is fever. You need to also know fever. You know the grades. You know how it moves. You need to know about Rye syndrome. Extremely important. Rye syndrome that affects children. So you don't give aspirin to children with chickenpox or flu-like symptoms. That's a problem. Then this is inflammation. You need to know what is involved in inflammation. You need to know the role of cytokines. You need to know the role of interferon, interleukins, TNF, that's tumor necrosis factor, chemotactic factors also. Extremely important because these are what helps for what? Inflammation. All right? So this is mobilization. This is containment. This is the type of white blood cells. Extremely important that you guys understand the type of white blood cells. Tissue cleanup and repair. How many minutes have I spent? Almost 30 minutes. No, I have to stop. Almost 30 minutes. I have to stop. Okay. So you need to know about edema and pus, all right? Like some minutes ago, somebody was asking me, a friend of mine was asking me about, edema and, other things, and we were discussing it. So I hope she's here so that she'll be able to understand what we are talking about. Because there are some questions we are going to answer based on this, all right? I know I speak fast, but I'm sorry. Later, when you are watching this video, you can slow it down to be able to get the areas you should focus on. So this is talking about immunity. We'll discuss it when we are answering questions. Forms of immunity, okay. Natural active immunity, artificial active immunity, natural passive immunity, artificial passive immunity. You need to know the differences. You need to know what antigens are, what epitopes are. All right? Epitopes, specifically epitopes are antigenic determinants, right? They are an area in an antigen. If you see an antigen, an area in an antigen molecule, that's what stimulates immune responses. You understand? You need to know what haptens are. You understand? Extremely important. You need to be able to differentiate antigen, epitopes, and haptens. All right? Then the immunoglobulin, you need to know this chain. Extremely important. I'll show you a question on that. You need to understand the immunoglobulin, these different types of immunoglobulin, G, E, D, M, and A. Where do you find them? For example, IgA is found primarily in secretions like what? Tears. So if somebody is crying, tell the person, stop wasting your IgA. Hey, Nchebe, you play too much. I'm serious. You understand? They broke somebody's heart and the person is crying, and you're telling the person, stop wasting your IgA. You understand? It's terrible, man. Honestly. Or you see somebody that is busy having indiscriminate sex, you tell the person, why are you wasting your IgA in your semen? You understand? Because the person will be wasting semen. So why are you wasting your IgA? So just know how to apply this thing so that you can remember it. Oh, now all of you know that IgA is mucus, tears, saliva, semen. All right? If you see two people kissing in the ferry or anywhere, just look at in your mind. Don't say anything before they will sue you. You guys can sue in this country. So just tell the person, tell them why are you guys sharing IgA in your mind, please. Or you see somebody say, please, can we share IgA? You are talking about kissing. So the same thing you should know about IgM, IgD, IgE, and IgG, especially IgG. All right, you will see some of them in your questions. Okay, so each of them were discussed one after the other here. So I believe you've taken time to read it. I believe. I am counting on you guys. Now, when you're talking about lymphocytes, right, they are one of the major immune system cells, like lymphocytes, macrophages, dendritic cells. We've already discussed about 6 of them. We discussed the 6 of them, so you should know them, not just these 3. So this is lymphocytes specifically. You have the natural killer cells, we have the T lymphocytes, and we have the B lymphocytes. The T and the B lymphocytes are part of what? Adaptive immune system. Why the NK cells are part of what? The innate immune system. They will ask you this question. You need to be able to know the difference. But the 3 of them are under what? Lymphocytes. Why is this slide like this? Okay, so this now starts classically defining lymphocytes, how they are, distributed. These are antigen presenting cells. You need to also know antigen presenting cells. All right, T cells cannot recognize antigens on their own. So antigen presenting cells are the cells that bring an antigen and tell the T cell, hello T cell, come. T cell, look at an antigen, kill it. T cell will just kill it. Shum. Macrophages will come and swallow it. Do you understand? So this is antigen presenting cells. These cells cannot recognize antigen themselves. So the question they will be asking you, what are examples of antigen presenting cells? Or what cells function as antigen presenting cells? You tell us dendrocytes, even the macrophages themselves, reticular cells, B cells, all these things are antigen presenting what? Cells. One of the following is an antigen presenting cell, except. Now, what are the functions of antigen presenting cells? You understand? Identification tag. You know that tag that they put, do not resuscitate. Hey, God. That kind of tag, right? That is what these APCs do. They will put a tag on this, on a particular antigen, and say this is antigen that you should kill. The T cell will see, oh, this cell has been marked for killing. Pium. Do you understand? So you need to be able to understand that. Okay. So these are everything about antigen present cells. You need to look it up. That this is cellular immunity, also very important aspects. All right. The 4 classes of T cells, we have cytotoxic T cells, helper T cells, regulatory T cells, and memory T cells. Even from their names, you should know what they do. Cytotoxic, very toxic. You understand? People that are in toxic relationship, they will understand what I'm talking about here. Cytotoxic, very toxic. Kim, carry out an attack on an enemy, kill the enemy. Helper T cells, they help to promote what? Cytotoxic T cells and B cells action. They are just helping. Example of cytotoxic T cells is CD4. If you have taken care of patients with HIV, you hear, oh, CD4 counts, oh, this one counts, CD8 counts, but usually CD4. Because CD4 promotes CD8. That's what you need to know. CD4 promotes CD8. Very important. All right? So effectors are the CD8, which are cytotoxic T cells. Why CD4 are what? Helper T cells. All right? Then we have regulatory T cells. Some CD4s are also regulatory T cells. Extremely important that you know that. Then we have memory T cells, which is what? TMs. All right? Okay, so this is how they function, how they recognize, and how they activate what? T cells. All right? Extremely important that you understand it. So this system completely explains it properly. Antigen recognition, co-stimulation. You understand? Which is when T cell binds to the protein on the antigen presenting cells. Extremely important that you know this. Also, we have the clonal selection. We have the attack. So these are things that you need to know. This is what the helper T cell does. You need to understand it. Okay. So this is memory cells, the one that can remember that infection and be able to take care of it when the time comes. This humoral immunity, right? Just, another form of defense, all right, but not cellular, all right? Another form of defense, not cellular. This is where it's discussed. You understand? Usually by plasma cells that produce what? B cells. Okay. So these B cells differentiate into memory cells. That's another thing you need to know. So this is what happens. You understand? This antigen recognition, this antigen presentation, this clonal selection, this differentiation, and this attack. All right? Because they need to be activated when they see the antigen. That's when they become what? Activated. So it's extremely important that you remember this. So this is the attack proper. You understand? For the attack, you have to neutralize. You understand? The complement has to be fixed, specifically IgG and IgM. Extremely important. Why? Because they cause what? Cytolysis, cell clearance, immune clearance, phagocytosis, and inflammation. Extremely important that you know this. Then after that, we'll talk about agglutination and we'll talk what? About precipitation. Very important. All right? So these are other responses you also need to know. I'm trying to fast forward. Now, this is hypersensitivity. I don't know if I discussed hypersensitivity with you guys, but hypersensitivity is also very important, all right? Because that's how you'll be able to understand infections like what? Asthma, all right? How it happens. Hypersensitivity is an excessive immune reaction against antigens that most people tolerate. Also, that's how you also know these blood transfusion reactions. You understand? So these are the things that are included in hypersensitivity, like alloimmunity, autoimmunity, allergies. Like asthma patient, how they react to themselves. Alloimmunity, you give somebody kidney and the person start reacting. That's hypersensitivity. All right? Autoimmunity, the one that the person is reacting to itself. It's also hypersensitivity, just like diabetes type 2 patients that has an auto allergy against themselves. All right, autoimmune disease, which the body fights against its own receptors. Extremely important. And all these things are part of what hypersensitivity 1. We have type 1 hypersensitivity. So all these things are type 1 hyper what? Sensitivity. So they may ask you in the clinic, oh, Mr. A was transferred so and so organ, and after so and so hours, he started reacting to that organ. That is hypersensitivity 1. Oh, this person is reacting to poison ivy, or this person was bitten by a snake and is reacting, or Nchebe took milk and Nchebe started what? Reacting. I told you I'm lactose intolerant, so you understand what I'm talking about. Start reacting. All right? What is it? Type 1. So you need to know that it is type 1. And this is type 2. Type 2, 4 types, right? We have acute, we have subacute, and we have the ones that are delayed. Acute, subacute, and the ones that are delayed. All of them are what? Type 2 hypersensitivity reaction. All right? Okay, then we have type 3. And these are immunodeficiency diseases. We already know about this. This HIV structure, how HIV functions, how it kills down the immune system. This is AIDS, acquired immunodeficiency virus syndrome. You need to know the difference between HIV and AIDS, all right? Though this is not a pathology exam, this is an anatomy exam. So you need to know the normal, but in the clinic, they expect you to understand what? The abnormal. How all these things are transferred, how the CD4 prevents, how the CD4 assists the individual, how the medications also function. Because if you don't know how these things function, you will not be able to know the pharmacology of the entire thing. All right, so I think that is it. That is just a brief recap. 40 minutes, that's fine. So I'm going to ask you questions. I hope you guys are very ready, because I need you to be very fast. I need you guys to be very fast. If you are very fast, we'll be able to finish this thing in time. I won't be able to explain others. I just explained the immune system because people were sending me messages that they don't understand the immune system very well. So I promised I'll give a little recap before I start the main thing. Okay, so I want to start the main thing. Are we ready? Or was I talking too much? Sorry. Are we ready? Yes? Okay, perfect. This one person is responding. Ha! Please, every question, more than 10 people should respond. See, look at the rules, guys. You don't need to open your slides. You understand? Take this as your exam. You are writing an exam. Is that Kalisha? Take this that we are writing what? Exam. Just pick, don't look at anything. Don't check your internet. Don't check whatever. Keep your phone right now. That food you are eating, I say you are eating something. Stop eating that food. You are distracting your brain. Just pick your answer. Even if everybody is picking theirs, pick yours. Don't follow the crowd. And don't be ashamed of whatever you picked. No, it's better that you failed it now and get it in exam hall. All right? But I need you to be very fast. And if you are not sure of what the answer is, write not sure, write 911, write emergency. We need food. Should I give you location? If I give you location, you come and eat. Oh? So guys, I need all of you to remember this, please. All right? So nobody should be silent. If you're silent, I'll call you out. So I see the names of everybody here. I see everybody. So if I put an answer, I will expect all of you to answer, please. All right? We good? I hope we understand each other. Am I too close to the camera? I guess. So let's test the microphone, guys. Let's test the microphone. No option. Quickly. Testing the microphone. Special lymphoid vessels called lacteals absorb dietary dash that are not absorbed by the blood capillaries. Come on, guys. Ha. First question, no. First question. Ha. Somebody say lipid. You want options? Water, glucose, vitamins, amino acids, and lipids. Yes, so the answer is this is just testing the microphone. I don't understand why you guys are so not okay. So there's most of the answers I'll be saying it out. Options. So lymph is similar to blood plasma, but very low in dash. We have protein, we have carbon dioxide, we have metabolic waste, we have electrolytes, we have sodium and potassium. I won't be posting these particular ones because it will take our time. So I will just say it out. You have to pay more than usual attention, all right? Lymph is similar to blood plasma, but very low in dash. We have protein, we have carbon dioxide, we have metabolic waste, we have electrolytes, we have sodium and potassium. No, I see. I know you made a mistake. That's fine. Okay. Yeah, you guys are activated. Somebody has woken up. These are testing the microphone. Oh. Hello, hello. Okay. No, it's okay. You don't need to be sorry there. Okay, look at this one. Dash at the okay. I have to post this option so that you guys don't get confused. Okay, so I'll post you options. Post options, but you have to be very fast, all right? A, B, C, D, and E. Okay, guys. Dash are the largest of the lymphatic vessels and they empty into dash. Don't open your book. Somebody's not doing like I need you to attempt these questions like you're in the exam hall. Dash are the largest of the lymphatic vessels and they empty into the dash. Hmm? I thought you guys promised me that you'll be faster. What's happening? Okay. Yeah, you guys are so correct. You guys are so correct. The answer is D, collecting ducts, subclavian veins. All right. So collecting ducts, subclavian veins. I hope you know how we got to that answer. So, but I want to ask you this quickly. Yes, the answer is D, guys. Yes, you guys did very well. The answer is D, not C. All right. So, somebody said C, so take note. All right. The answer is collecting duct and subclavian veins, not arteries, veins. You see how they put the subclavian artery there to confuse you, and it's not trunk. The largest is the ducts. Okay, look at this, guys. Dash are found especially in the mucous membrane, standing guard against parasites and allergens. Standing guard against parasites and allergens. Options A, monocytes, lymphocytes, basophils, neutrophils, eosinophils. If you see how you think about this question, if you're in the clinic and you do a CBC, that's complete blood count, and you see an elevated monocyte, what will you diagnose of that patient? Elevated lymphocytes. What are you thinking? Elevated basophil. What are you thinking? Neutrophil. What are you thinking? Elevated eosinophils. What are you thinking? That's what they're just telling you. So, for example, if you are thinking parasites and allergens, which one are you expecting to be elevated? Mm-hmm. Yes, the answer is eosinophil. All right. The answer is eosinophils. Okay. I wanted to look at this. Look at this question, guys. Immune surveillance is a process in which Dash non-specifically detect and destroy foreign cells and disease host cells. I'll give you options. Please listen attentively. A is T lymphocytes, that's T cells. B is reticular cells. C is dendritic cells. D is macrophages, and E is NK cells, natural killer cells. T lymphocytes, reticular cells, dendritic cells, macrophages, and natural killer cells. Is that all? 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 people. You guys have to come over. Let me see who didn't answer. Jordan, Ivory, Gabby. I'll be calling them out. People that didn't answer. You have to answer. Exactly. You have to put your own answer. Whether it's the same thing, I don't have a problem with that. So, guys, you guys need to know about the NK cells. They patrol the body to kill abnormal host cells and pathogens. Non-specifically, they just go anywhere. Anywhere they see the cell, they'll kill it. All right. But macrophages act as cleanup crews that engulf debris and alerted what? Pathogens. That's the difference between them. Did you? Okay. Thank you. Your name is sweet in my mouth, so I'm always calling it. All right. Then we have the cytotoxic T cells. These cytotoxic T cells, they kill specific enemy cells. You understand? But after, they have been specifically programmed to what? Recognize them. So you need to know the difference between NK cells, macrophages. NK cells, they just go anywhere, they patrol anywhere to kill, right? But macrophages does what? They mop up, they are cleaners, they are cleanup crew. They engulf debris, they engulf pathogens and clear them from the system. But cytotoxic T cells has to be what? Alerted. It has to be activated. It has to be programmed specifically to recognize this particular antigen and kill it. That's the major differences between the three of them. So for NK cells, immediately they recognize that target cell, what do? They release porphyrins, all right? Porphyrins puncture holes, because they may ask you about porphyrins. They may ask you about granzymes. Porphyrin puncture holes, all right? And then in the cell membrane, and then the granzymes, they will trigger what? Apoptosis, that's cell suicide of that particular cell. That's how they kill. Very, 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 very non-specific method. Okay. So natural cell NK cells, all right? Okay, look at this question. I need you guys to pay attention. When I will start posting the options, I usually when the option is long. If it's just one word like this, I won't post it because it's take time. So which of the following is not an example of lymphoid tissue? Please pay attention. What? A, aggregated lymphoid nodules. B, malt. That's MALT. Then C, lymphoid nodules. D, macrophages. And E, diffuse lymphoid tissue. A, aggregated lymphoid nodules. B, molds. C, lymphoid nodules. D, macrophages. And E, diffuse lymphoid tissue. I have to be posting the answer because I'm not repeating it 22 times. Aggregated lymphoid nodules, malt, lymphoid tissues. The third one is lymphoid nodules. The fourth one is D is macrophages, and E is what? Diffuse tissue. Gabby answered very fast, so that I will not call her. Jordan, you said mac. Is it mac and cheese? Come on now, guys. Where is Chanel? Where is Kayla? you guys answer fast, we move fast so that we can finish on time. If not, once it's 3 hours, I will stop. Yes, macrophages. Yeah, the answer is macrophages, guys. So look at this question. Yes, macrophages. I'm here. All right. T cells achieve immunocompetence in the dash. Where does they achieve? This is a giveaway question. You can't be tired. If you're tired, put your leg in cold water. I've not even started and you're tired. Hey, God. Put your leg in cold water. T cells achieve immunocompetence in the dash. Quickly, guys. Quickly. Perfect, guys. Perfect. Thank you so much. That answer is correct. Removal of the dash would be more harmful to a 1-year-old child than an adult. We have the spleen, we have the lymphoid node, we have the thymus, we have the appendix, we have the palatine tonsil. You guys have started responding. Vedette is always laughing with the tongue out. She's happy this night. Vedette, you ate mac and cheese? Removal of the dash would be more harmful to a 1-year-old child than an adult. Yes, the answer is thymus. Yes, both of them are thymus, all right? Look at this question, guys. I don't want to waste too much time. Look at this question. What was the answer to this question? Let's see. Let me give you options. You need options to be able to pick this. This is A. This is B. This is C. Is if something is telling you to sleep, reject it and rebuke it. Better stand up and stand as you are doing this class. Stand. It's better for you to stand than to be hitting your head on the wall. I know I'm very boring sometimes. So this is the options. Which of the following does or do not belong to the second line of defense? The macrophage system, the natural killer cells, inflammation, the gastric juices, the interferon, and the complement system. Which one? Come on, guys. Yes, you guys are so correct. The answer is the gastric juice. Yeah, the gastric juice is D. I believe is D. It's gastric juice, guys. Okay, let's look at this. We are done testing the microphone now. Let's go to the main questions, all right? The main questions. We are done testing the microphone. So everything you've been doing all this while is testing of the microphone. Somebody will be like, what? Why am I testing the microphone? So look at this question, guys. I'll give you option. I'm very generous with options, all right? Very, very generous. This is A. This is B. This is C. This is D. And this is E. Dash lacks the capacity to remember a pathogen or react differently to it in the future, whereas Dash utilizes memory cells to adapt to a given pathogen and ward it off more easily in the future. Yes, the answer is D. You guys are very correct. So I believe that you must, in your book right now, you must have written the comparison, you understand, between, innate immunity and adaptive immunity. That will really help you, all right? Like you can break it down into different features, like for example, response time, specificity, memory, components. Those are, if you write it like that, response time, specificity, memory, components. You put innate immunity, you write everything, adaptive immunity, you write. So for like innate immunity, right, the response time, immediate, minutes to what? Hours. Make sense? For adaptive, the response time is what? Slow, days, weeks for first exposure. That's response time. Then specificity, innate immunity is general, recognizes what? Foreign bodies, all right? That's innate immunity, general. Adaptive immunity is highly specific, recognizes a very specific strain, all right? Also, when you're talking about, what's the third one? Memory. Innate immunity, no memory. Adaptive immunity, persistent memory cells. All right. So for this exam, you guys must be what? Adaptive what? Immunity. All right. Now the fourth one is the components. You need to know the components. For innate immunity, you have barriers, right? Barriers, all these skins and others. Skins, mucus, and yes, skin, mucus, and other things like inflammation, like NK cells is also part of it. All right, barriers, phagocytes, and others. Now, adaptive immunity, we have what? B cells, T cells, B cells, antibodies, and T cells. Extremely important. If you're able to understand it like this, group it like this, you will get all these questions. What can they ask you? No matter what the spirit tells them to ask you, they cannot do anything. So, guys, the answer is D to that question. Innate immunity and adaptive what? Immunity. Extremely important. All right. I hope you did the chart. If you didn't do the chart, if you want to remember how I said it, you can go back, slow it down, write it out. Extremely important. Look at this question. I'll call out the options. One group of proteolytic enzymes secreted by natural killer cells is A, selectins, cytokines, granzymes, perforins, and interferon. Quickly. This one is giveaway now. I don't know why this question is here. This question is testing the microphone question now. I thought before I even finish reading the option, everybody must have answered. What's happening? What did you people eat this night? Hope none of you swallow gari o, apple. Should I call the options again? Yes. Selectins. Can you repeat the question? That's the question already. I'm talking about the options, so I'll call it once more. Selectins, cytokines, granzymes, perforins, interferons. Why you don't repeat the question? The question is written now. I posted the question there. One group of proteolytic enzymes secreted by natural NK cell is dash. Why is everybody asking? But it's there. I posted the question now. What's wrong? I posted the question now. I've posted the question since. What do you mean it's not there? Something I'm looking at right now. Okay, let me post it again. I'm looking at it right there. One group of proteolytic enzymes secreted by natural killer cells, NK cells, is. Why don't everybody see it? Is something wrong with what I'm posting? I guess because everybody's telling me repeat question. The options is what you can tell me to repeat because I didn't post the options. Really? Then something must be wrong. So that's the question. One group of proteolytic enzymes secreted by natural killer cells is dash. A. Selectins, cytokines, granzymes, perforins, interferons. Okay, so it's granzymes. It's not grand enzymes. It's granzymes. But I understand what you guys are writing. So there are two things that NK cells does. It does perforins and it does granzymes. It produces perforins and granzymes. Perforins just from the word perforins, perforate, pore forming proteins. All right. Granzymes are the proteolytic enzymes, that's proteases, right? That causes what? Apoptosis. When you're talking about interferons are signaling proteins, right? An example of interferon is an example of what? Cytokines. You understand? They just interfere with viral replication and alert neighboring cells. They are not directly killing enzymes, all right? Now we have selectins. Selectins are just for adhesion, cell adhesion molecules that, they help white blood cell to stick to blood vessels, right? Like work like this, stick, selectin, stick, selectin, stick, selectin, stick, until the white blood cell get to the point of the point where it will do magic, where it will destroy whatever. Then cytokines are just a broad category of what? Signaling molecule. Example of cytokines are what? Interferons. So I need you guys to understand the meaning of all these things so that any questions they bring, another question can be from interferons. They can ask what is interferon. They can ask you what is selectin. They can ask you what is cytokines. You need to remember, all right? So that's why I'm taking my time to explain all these things. All right? Yeah, I know it's type. I was just playing. Now look at this question. So the question that they're going to ask you will be very superficial. Oh, Alex is here. Alex, I'm seeing you for the first time. Welcome. So look at these questions, guys. Basophils of the blood helps to get defensive leukocytes to the site quickly by releasing an anticoagulant called dash and a vasodilator called dash. I don't want to give you option. Just give me the two answers quickly, guys, quickly. Okay, fine. I'll give options. A, bradykinin, histamine. B, selectin, prostaglandin. C, histamine, heparin. D, heparin, histamine. E, prostaglandin, selectin. C is histamine, heparin. That's what C is. D is heparin, histamine. So you need to know which one is beginning, which one is ending, if that happens to be your answer. A, bradykinin, histamine. B, selectin, prostaglandin. C, histamine, heparin. D, heparin, histamine. E, prostaglandin, selectin. Yes, the answer is D. Yeah, the answer is D. B, somebody said B. Okay, Ivory, B is selectin, prostaglandin. No. All right. The anticoagulant is heparin. And for the one that opens the door, the vasodilator is histamine. All right. You can't forget, please. All right. But, it's good to attempt. Don't be shy to attempt. Nobody's beating you here. Remember, NK cells are what secretes what? Perforins, right? They are the ones that secrete what? Perforins. All right? To perforate. Perforin to perforate, and also granzymes. Remember that, because I don't want to ask this question. I'm jumping it. I'm jumping it. I'm going to more serious questions that you most likely... Look at this question, guys. You see that thing I was telling you, that you need to know everything about A and B, C3B and C3A. Look at the options, guys. Just relax. I will ask you, I will give you the options. I'm very generous with options this night. Too much generosity is killing me this night. So that's A. That's B. That's C. So guys, I'm not gonna go to the slide for the other ones. All right, I will just jump into the questions straight so that we don't waste too much time. I had a long day today, so I'm extremely tired. Somebody said Nchebe is not tired. Nchebe is always tired, actually. Just that I don't show it. So guys, let's go. Complement C3b protein casts or coats bacteria and stimulates phagocytosis by dash during a process called dash. Come on, guys, let's go. Where is my people? If you don't know it, put 911. I can explain. Okay, you guys are so correct. Now, let me give you a little explanation about opsonization so that somebody that doesn't know it will know it, in case if they ask you a question in a different way. When you are thinking about opsonization, I want you to think opsonization as like, Jesus, how do I explain this thing? Oh, Lord. Okay. You see this, my mouse pointer? Let's assume this mouse pointer is a bacteria, all right? You see how smooth it is? Very, very smooth. You understand? Meaning that, you know, if you hold it, it can just slip out. That is how some bacteria are. So some bacteria are they have very slippery capsules that make them very difficult for neutrophil to grab it and for macrophages to digest it. Do you understand? So that's where complement 3B, C3b comes in. You understand? So because complement 3CB is a specific protein that acts as what? Opsonin. Now, what does it do? Once it sees this bacteria, it will add seasoning to this bacteria. Seasonings. Maggi, put tomato, put juice, put everything on this thing. Do you get? It will become rough. It will become noticeable. It will become appetizing. So the neutrophil will come and, oh, this looks very chewy, very yummy. It will engulf it. It will eat it. Macrophages will engulf. Neutrophil will break it down. So the idea of complement 3B is to tagging. Put tagging in your head. Put it in your head. You understand? It's a tagging system to tag this guy so that this guy will become more obvious, more appetizing, more seasoned for neutrophil and macrophages to come and what? Eat it up. That is the meaning of what? Opsonization. But when you're talking about cytolysis is just, you know, physical rupturing of a cell. You understand? It can be maybe using MAC or membrane attack complex. That's MAC, MAC. All right? You understand? To rupture this cell. But opsonization is specifically tagging so that something else can come and what? Consume. Any question? No question. I did not hear any question. So we move. Somebody's busy laughing. I hope you are laughing with me. You are not laughing at me. There we are. Okay, look at this. Dash are secreted by cells infected with viruses, alerting neighboring cells and protecting them from becoming what? Protecting them from becoming what? Infected. Options: complement system globulins, interferons, granzymes, pyrogens, perforin. Please just give me 1 second. Sorry. Okay, the answer is interferons. Someone say inter. Okay. I did marathon race now. Also, I need you guys to know that interferons, yes, the answer is interferons. I need you guys to know that interferons are antimicrobial proteins, all right? If they ask you a question about antimicrobial proteins, you say what? Interferons. All right? Those are the two major questions they always ask. Okay. Look at these questions, guys. Endogenous pyrogens are produced by A, if you're listening, A, bacteria, B, mast cells, C, neutrophils and macrophages, D, plasma cells, and E, viruses. Answer. Answer, guys. Is my phone ringing? I don't even know how to control this laptop. How do I disconnect calls when it's entering the same laptop I'm using? You guys that use Mac, you can teach me these things. I honestly don't know it. Like, I'm trying to disconnect the call and it was still entering my phone. I should mute it. I didn't even see a button to mute. Like, I really don't understand how this laptop works. That's why I love my Samsung. You guys pushed me into using Mac, and now I don't even understand it. Okay. The options: bacteria, mast cells, neutrophils and macrophages, plasma cells, and viruses. No, I can't pick up now. It's my brother-in-law. He's calling me from Canada, and I will talk to them later. The call is always very long. My brother-in-law and my sister. So, Mark is better. How is he better? Please, you guys should answer my question. How is Mark better? Could have just bought Samsung, the new Samsung. Somebody said I should repeat the question. This is the question. Endogenous pyrogens are produced by dash: bacteria, mast cells, neutrophils and macrophages, plasma cells, and virus. And the E is viruses. So what's the answer, guys? Quickly. Plasma cells is D, viruses is E. A is bacteria, B is mast cells, C is neutrophil and macrophages. Vede, this is your tongue that you're always bringing out. Is that with scissors? I even have scissors here. See, just bring it. Yes, the answer is C, guys. The answer is C. All right, neutrophils and macrophages. Extremely important that you know that. What is a pyrogen, guys? You need this question. You need this for the clinic mostly. What is a pyrogen? A pyrogen is a substance that causes what? Option A, inflammation. Option A, inflammation. Option B, opsonization. Okay, I don't need to post now since you guys are already answering. Option B, opsonization. Option C, complement fixation. Option D, cytolysis. Option E, fever. Very soon I'll be calling you Tonglin. Tonglin. Tongamad. Yes, guys, the answer is fever. So you need to know about pyrogens. 25. Okay, look at this question. Yes. Yes, you guys are so correct. Look at this question. Which of these cellular agents does not participate in inflammation? Which one does not participate in inflammation? Let me give you options. We have cytotoxic T cells. We have macrophages. We have eosinophils. We have neutrophils, and we have endothelial cells. So which of these cellular agents does not participate in inflammation? We have cytotoxic T cells. We have macrophages or macrophage. We have eosinophils, and we have neutrophils. We have endothelial cells. Quickly, guys. Okay, nice that you guys answered, and I like the fact that you guys your answers are variable. Yes, the answer is A, cytotoxic T cells. So the question is, why is cytotoxic T cells not part of inflammation? The reason is because inflammation is a response of the innate immune system. Innate, all right. So its goal is to quickly contain an injury or infection, recruit help, and clean up the debris. You see these three things I just said now? That's what happens in inflammation. Contain the injury. That's why it's inflamed. It becomes swollen. Just that particular place. Contain the injury, all right, or infection. Immediately it contains it there, keeps it there. You now ask for help. You recruit help. Immediately it recruits help, and what happened? It cleans up the debris. So cytotoxic T cells is part of adaptive, not innate, adaptive immune system. It's like a trained assassin. That's what cytotoxic T cell is. You understand? So they are not standard participants in an acute inflammation. No. So you need to know the roles of other agents like endothelial cells. What's the function of endothelial cells? Endothelial cells, this one, they line the blood vessels. This is the blood vessel. This is where the blood is flowing. This is the blood vessel. And you have an injury here. So what happens? This endothelial cell, we want to open up so that the components in the blood, right, can seep inside, leak inside to this place that you have an injury so that they can clear the debris. That's the idea of endothelial cells. Then the neutrophils are always the first responders. 911, they are the ones that always rush to your house when there's a problem. Yes? So they migrate immediately to the site of inflammation, massive number. To what? To eat up bacteria and to release what? Chemicals that kill pathogens. What about macrophages? They come later, like slightly later than the neutrophils. You understand? These ones are heavy-duty cleaners. These ones that used to clear snow. They take their time. They don't rush. Heavy duty. Do you understand? That are macrophages. All right. Why we have the cytokines, right, which helps to signal for help. Then we have the eosinophils, which are specifically involved in inflammation related to what? Parasitic infections and allergic disorders. You need to know these things one after the other. So that any question they throw at you, you chest the question like this and you say nothing. In my place, we call it Odesh. Let me keep quiet though before you people change my name. Okay, so I'll ask you just very few questions and we'll be done. I don't want to continue pushing this. I'll ask you just very few questions and we'll be done, all right? So look at this question very fast. I'll give you options. I hope you understood what I explained. If you don't, it's okay. You can always tell me. I'll re-explain it, all right? So this is A, incoming. I hope you are taking the proper notes. Don't write everything I say, please. If I cough, you write. Please don't. But just take the proper notes, all right? It will really help you, especially sometimes when I'm explaining some of these concepts. A, B, C. Okay, that's C. And this is D. This is E. Okay, guys, let's go. One characteristic of the immune response is specifically immune. One characteristic of the immune response is specificity. This means that come on, let's go, guys. One characteristic of the immune system is specificity. What does specificity mean? So this one is very straightforward now. Even if the fact that it's long doesn't mean anything. Yeah, so yeah, it means some people say the answer is D. Which is a specific group. D, immunity is directed against a particular what pathogen. You understand? So look at this question. Here is the options. Yes, immunity is directed against a particular pathogen. All right, that's the answer. Look at that particular question I just posted. What is the answer, guys? Epitope A, disulfide bridge B, haptane C, MHC, that's major histocompatibility complex C, D, and antibody monomer. Epitope, disulfide bridge, haptane. Somebody is going to go and check the difference between epitope and haptane. Don't do that. Resist that temptation and pick your answer. Epitope, disulfide bridge, haptane. I already posted the question. Now I'm looking at the question here. What's wrong with today? Hey, I'm scared though. Because I'm looking at the question here. Let me post it again. Did you see this one I just posted again? Please tell me yes. Yes. Maybe I will start posting questions 2 times. So I'm surprised. I'm surprised. Honestly, because I post questions before I even start talking about it. Okay. Yes, epitope. All right. I want to just okay. Yes, the answer is epitope, guys. You need to know the difference between epitope and haptane. The next question they may ask you is haptane, but I won't post it here because, like, it's waste of time. Now look at this question, guys. DASH constitutes about 80% of the circulating antibodies in plasma. We have IgD, we have IgE, we have IgA, we have IgM, and we have IgG. See why I told you that you must learn that thing? DASH constitutes 80% of circulating antibodies in plasma. We have IgD, we have IgE, we have IgA, we have IgM, and we have IgG. Somebody's asking me question. Am I the one that will answer it in the example? Please talk to me. He says, is it IG? So you guys didn't study it? Hmm? Oh boy. I will call name, so you should respond. I'll call name and stop Googling. Oh boy. After Googling, you tell me if it's G. I thought if we just, I expect immediately I ask this question, just put the answer. Beam. Do you understand? I need to see these things. Like, come on, guys. Okay, see, let me just tell you about the thing. The answer is IgG, all right? And I'm not going to tell you about the others. Go and read it up. There are a lot of questions that will come from the others, all right? One thing you need to know about IgG is that IgG is one of the most biggest, about 80% of the antibodies in your blood. 80% in the blood plasma. 80% is IgG. All right, and this is why it is only the only antibody that's capable of what, of crossing the placenta. They will ask you which one crosses the placenta. I'm giving you tips now. That's IgG. You understand? Because they are the ones that provides autocorrect. Okay, they are the ones that provides what, the immunity, passive immunity for the baby before birth. All right, and they have the longest half-life. You understand? They help in opsonization that we are discussing about, neutralizing toxin, triggering complement system. That's why they are very, very important. All right, that's IgG. Why IgA makes up 10 to 15%, right? Where is it found? IgA is found where? In the saliva. I told you, saliva. Saliva. Is it saliva? Tears, rather. Hi, Nchebe. Oh, Jesus. I'm hungry. Tears, saliva. So when you exchange saliva, when you kiss anybody indiscriminately, you are exchanging what? IgA. Aha. Breast milk. When you understand, you know what I'm talking about. You are taking IgA. When you give it to your baby, you are taking IgA. When you give it to your partner, it's IgA that you are giving. All right. Aha. Gas helps to guide the surface. While IgM is usually produced as an initial infection antibody, initial infection antibody. That is always IgM, the first one that comes, very large. All right, then we have the what again, IgD. You understand? IgD functions as a receptor, usually as a receptor on the B cell surfaces. Very, very important that you know it. Why IgE is usually allergic reaction. Allergic reaction. So if you know IgA, you know IgG. That's very, very important. All right. So the answer to this one is what? IgG. That's the answer to this question. IgG. I'm not going to ask you the other ones because I don't. You see what I'm just saying? You see what I'm saying? So, guys, is everybody awake and alert? Say yes. Give me 10 yeses before I pose this question. Quickly. 1, 2, 3, 4. Driving. Okay. 5, 6, 7, 8. Come on, guys. Come on. Let's go. Come on. Let's go. 9. 10. So apart from let me see who is driving. Somebody said driving. Mr. Sunday. Apart from Mr. Sunday that is driving, all these 14 people, I need you to give me this answer immediately. Don't think. Don't think it. Just give me this answer immediately. Oh yeah, are you ready? Yes, you are ready. 1, 2, ready, go. Let me see the first 10 people. Bam. Answer. I hope you people can see it because let's say you say you do not see my question. Mhm. Okay, you guys are so correct. Okay, so I need you like just I need you guys to answer this question like this. So now I'm putting this question in the box, which is the correct sequence of events in the humoral immune response. As I'm posting it, I want you to start looking at it and give me the answer quickly. Yes, IgA is correct. So let me post A now. A. Incoming, incoming, incoming. This is A. B. This is B. C. This is C. D. This is D. And E. This is E. Quickly. Which is the correct sequence of events in the humoral immune response? B, I think. So let's think. Let's go, guys. Let's go. Where is everybody that said yes? Come on, guys. Move it. Come on, guys. Okay, so the answer is B. Antigen recognition. You understand? Antigen presentation, clonal selection, differentiation, and attack. You need to understand this one after the other. All right. Remember, the humoral response is the process by which B cells, specifically B cells, produce what? Antibodies to fight pathogens in the body and body's fluid, like blood and lymph. All right. So, first one is antigen recognition, right? B cell binds to a specific antigen that matches its unique, surface sequence. It binds to it. That was A on my screen. Yeah. Oh, really? How is it A on your screen? Huh? So that's antigen recognition. Now, the presentation is, oh, okay. Since you know the correct sequence, that's fine. That's fine. The second one is presentation. You understand? This is when it's usually when B cells internalizes the antigen, right? And displays fragments on its surface. Something is wrong. I don't understand. What are you saying? The answer is, okay, forget whether it's A, B, C, or D. It is antigen presentation. Sorry, it is antigen recognition, antigen presentation, clonal selection, differentiation, and attack. Did you get it? Did you get it? Yes? Yes, perfect. Yeah, so you need to know what each of them is. Okay. I was trying to explain it, but I forgot what I was explaining. So let me see. Okay, I think we should IgE is produced. So you know what? I think we should stop here for this thing because we don't have much time again. I think we should stop here for lymphatic system. All right. Anybody has a question? Anybody has a question? No. So we are going to stop here for lymphatic this thing. There are a lot of things I should have asked, but like I don't want to keep spending time on it. Let's go to the next section. The next section is respiratory system. Listen, question is going to come out from them almost equally. Lab. You want to take pictures before or when we are done? Last. Okay. So let's go. Okay. Okay, so let's test the microphone, guys. Yeah, let's test the microphone. Look at this question, guys. Air consists of about 78.6% nitrogen, 20.9% oxygen, 0.04% carbon dioxide, and 0.5% water. At sea level, 760 mmHg. What is PCO2? I hope you can see the question. I just posted the question. I hope you can see it, guys. You can see it? The options are 597 mmHg, B is 159 mmHg, C is 0.3 mmHg, D is 3.7 mmHg, and E is 37 mmHg. This is testing the microphone question. So this is testing the microphone now, guys. Why are we wasting time on testing the microphone? Yes, the answer is 0.3 now. Just multiply this thing. Just multiply 760 by how many did I even say is CO2 again? This is Boyle's law. Yeah, is it Boyle's law? No, this is Dalton's law, not Boyle's law. Yeah, it's Dalton's law of partial pressure. It's Dalton's law. Yeah, it's Dalton's law of partial pressure. So total partial pressure is 760. Total pressure is 760. So for PCO2, you understand, CO2 is 0.04. You understand? So just multiply by 760 and you get 0.304. So that's 0.3. So just multiplying this thing by the total. Simple. The percentage by the total. That's why I say it's what did I call it again? It's testing the mic. Look at this question. Look at this question. Options. We have alveolar dead space. We have tracheal dead space. We have anatomical dead space. We have conducting dead space. We have metabolic dead space. And we have the final and the most important option. Which is New York dead space. Upon inspiration, what is the name of the air in the conducting zone that is not available for gas exchange? Come on, guys. Come on. We need to move faster. Why are we wasting time? Yes, the answer is anatomical dead space. Let me save time for you and for me. You see this thing? This is not a question, but they will ask you, yes, anatomical dead space. See this thing I just posted? It's not a question, but I cannot ask this, start posting this question because it's too large. The options are too large, all right? So they will ask you, if one inspires through their nose, which one of the following answers has the correct order of structures the air would move through? You understand? Has the option that the air would move through. So you see this thing I posted, you are supposed to like know if it's correct, or if it's not correct, you rearrange it. All right, but you do that at your time. I won't be able to do it now. I've just posted it so that you'll be able to see this kind of question. You understand? The nares, the vestibule, nasal cavity, nasopharynx, or oropharynx. So you need to know the tree from beginning to ending. You see, when I was discussing it, you must know that tree because of this kind of question. All right. So let me go to the question that I would. Okay, look at this question, guys. I just posted it. I hope you can see the one I just posted. Emotional states are integrated by the dash. which generates an output that creates such respiratory variations as laughing and crying. Option A, VRG. Option B, PRG. Option D, DRG. We have VRG A, PRG B, DRG C, SRG D, and TRG E. A, VRG, B, PRG, C, DRG, E, SRG, D, SRG, and E, TRG. Yes, guys, the answer is PRG. That's pointine respiratory group. Very, very important, because in as much as the medulla oblongata handles the basic rhythm of breathing, right? The PRG acts as what? A modulator. I told you this is a modulator. It modulates it. And that PRG, it gets information from that hypothalamus, all right? And also from the limbic system. And the limbic system is the state of what? Emotion. You understand? Like crying, laughing, even gasping in surprise. You understand? The second one is the VRG. VRG, which is the ventral respiratory group. You understand? This one is the rhythm generator. Very, very important that you guys know it. Rhythm generator. The basic pace of rhythm, about 12 beats per minute. That's VRG, ventral respiratory group. But it does not have anything to do with what? The limbic system. So it doesn't affect laughing and emotion. All right. Then we have the DRG, that dorsal respiratory group. You understand? This one is the integration center for sensory what? Inputs. Right? It receives its information from what? Chemoreceptors. You understand? Like CO2, pH, and all those things. Then, also from stress receptors in the lungs. Then it will modify them, right? So that VRG will output them. So you need to know these differences. SRG and TRG, I don't know, maybe that one is in Brooklyn. Because I don't know about it. People in Brooklyn here, is there where SRG and TRG is? Somebody will soon beat me. They will beat me very soon. You say yes, sir. So what monitors the pH of the CSF? The pH of the CSF is monitored by which of these brain stems? You can see the question, right? The first option. Okay, let me post it. Don't worry, let me post it. This is A. Who is sleeping? Somebody is sleeping. I feel it. Anytime you are sleeping, they'll send me a notification. So that's A, that's B, that's C. Then this is D. Oh, people are already answering. I should have not even stressed. D, and this is E. Okay, keep going, guys. The pH of the CSF is monitored by which of these brainstem centers? Which one, guys? Come on now, you guys. If you waste time, it's already 2 hours. I wanted us to be faster so that we can do the last one. Waste time, we'll just stop here. Please. I'm worn out. Honestly, I'm worn out. Okay, yes. That is central chemoreceptors. Yes, that's correct. So, guys, you see this one? I want you to pick the answer very fast. Don't think. This is a no thinking option. Look at this one. No thinking option. A, PR. I just sent you the option in the group. I hope you saw it. A is PRG, B is DRG, C is VRG, D is SRG in Brooklyn, and E is TRG in Brooklyn. Let's see. Let's go. Move it. Ah, you guys have dropped to 60. Where is everybody? They're tired. Okay. Do you guys want us to? When is your exam? Your exam should be on Thursday. Do you guys want us to do this again on Monday? Maybe we'll take the last chapter and pictures on Monday evening by 9 o'clock. If that's fine by you, then we just concentrate on this one. When we are finished, we just do that one on Monday and the entire pictures. Because I don't want you to be tired. Like when you are tired, you don't get a lot of things. And the more you get here, the better for you. Yes, the answer to that question is VRG. I already discussed it. That works for you? Okay. That works for you. Yes, the answer to that question is VRG, but let me see if on Monday, no. It can't be earlier. On Monday, it will be maybe 8 to 9:30 at most. An hour, 30 minutes is enough for us to do it. 1 hour for the stuff and 30 minutes for pictures. Because I'm not teaching, I'm just going to pour out questions. And I really need you guys to understand that chapter very well. What chapter is that? Urinary system. So, yes. Let me see how many years I get. If I can get like 15 years, you guys are 19 here. So at least if I can get 15 years, I'll know that it's more than half of the class. Somebody said no. Can it be earlier? The no you are saying, is it no to, can it be earlier or no to? So this one say yes. 1 works for me. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, one more. Okay, so that works. So tomorrow, please, once it's 7 p.m., tell me, all right? So anywhere I am, I'll start driving home. Yeah, so remind me on Monday, not Sunday, Monday, because I heard that you guys have something else on Sunday. Even tomorrow, if I'm in the lab all through. I hope this weather will not affect me. Okay, so let's now focus on this one and finish it up quickly, so that you go and rest. I don't want you to have too many things in your head. All right? See, I'm losing weight. I told you guys. Don't worry. Very soon I'll be like this. Oh, like this. Shut out this place and this place. Okay, so which of the following output to the VRG to adjust the respiratory rhythm? We have DRG, PRG, NRG, SRG, QRG, and ORG, ZRG. Good. Now, what you need to do is to be able to know the difference between the kind of question they ask for DRG, VRG, and PRG. So that if you see it in the exam hall, you won't be doing rock, paper, scissors, say, shoe. Do you understand? Uh-huh. Look at this question. This is A. This is B. Do I have a video on respiration? I can't remember if I did a video on respiration. This is C. So I want us to end in the next 30 minutes. But you guys have to help me for us to finish at that time. This is D. I'm not seeing answers already. So what's the answer, guys? Which of the following is not a function of the respiratory system? Come on, guys. Here's all the people that were voting. Yes, the answer is D, guys. This one is a giveaway now. I'm not even going to talk about it. Look at this one. Which of the following is directly related to respiratory production of carbon dioxide? Look at the options. That's A. These are testing the microphone question as well. This is B. This is C. I see that somebody saw this. That means I made a video on this thing. Did I make a video on respiration? No, I didn't. Yeah, I don't know again. No. So what's the answer, guys? Quickly, guys. Yes, the answer is regulation of pH. I don't want to waste time on this particular question. Who can tell me okay, look at this question. I'm not giving option. Guys, yes, the answer to that question is regulation of pH. Look at this question. No option. The upper respiratory tract extends from the nose through the dash. Trachea, pharynx, larynx, alveolar, lungs. Thank you so much. The answer is larynx, not pharynx. Look at that question. Look at the option: nasal cavity, nasal fossa, nasal septa, nasal vestibule, nasal aperture. Come on, guys. Come on, guys. Come on, guys. Come on. Come on. Come on. Come on, Sava. Yes, the answer is nasal fossa. Nasal fossa. What are the most numerous cells in the lungs? What are the most numerous cells in the lungs? You want options? Come on, guys. These are testing the microphone question now. We have mucosal cells, we have type 1 alveolar cells, we have type 2 alveolar cells, we have dust cells, we have vibrisal cells. Come on, come on, come on, come on. I need us to finish in 30 minutes. Ha, only 3 people. Should I start calling names? Chaperon answered, another answered, vedette did not bring out tongue this time. Yes, Z answered. Okay, Sunday is driving. Don't type while driving. No. Where is Darling? Are you driving as well? No, endothelial cell is not in the option. No. The option is mucosal cells. Maybe that's why you're calling endothelial cells. mucosal cells, type 1 alveolar, type 2 alveolar, dust cells, vibration cells. And yes, the answer is dust cells. Okay. Which of the following does not contain cilia? Which of the following does not contain ciliated cells? Which one doesn't contain ciliated cells? We have the nasal cavity, we have the trachea, we have the primary bronchus, we have the terminal bronchi, we have the laryngopharynx. That's the option, guys. Nasal cavity, trachea, primary bronchus, terminal bronchi, bronchiole, and laryngopharynx. Come on, guys. Come on, let's go, guys. No time. Yes, the answer is laryngopharynx. Eh? The answer is laryngopharynx. How about this? I hope you can see the question. Yes. Yes, laryngopharynx. Yes, you are correct, Mr. Sunday. So look at this question. Which bronchus is about 5 cm long and slightly narrower and less vertical than the one on the opposite side? We have the left segmental bronchus, A, right segmental bronchus, B, right lobar bronchus, C, left main bronchus, D, and right main bronchus. Which one? Yes, left main bronchus. You guys are so correct. The answer is D. Look at this one. I hope you can see what I just posted. Can you see what I just posted? Yes. So I'll give you options. Hold on. Yeah. So we have the pharynx, we have epiglottis, we have oral cavity, we have tongue, we have lips. Pharynx, epiglottis, oral cavity, tongue, and lip. Okay, yes, the answer is epiglottis, all right? And this is option to this question that I want to post now. I've not posted the question, but that's the option. I'm not posting questions before option. Look at the question here. Which law states that the total pressure of a gas mixture is equal to the sum of the partial pressures of each individual gases? Boyce, Varsavas, Dalton's, Charles Henry's. Which one? Yes, you guys are so correct. The answer is Dalton. I even mentioned this when I gave you that question. All right. This is the option for this one, and this is the question. In a healthy person, which of the following will have the greatest influence on the resistance to pulmonary airflow? We have the atmospheric pressure, we have the respiratory rate, we have the bronchial diameter, we have the quantity of surfactants, we have the contraction of the diaphragm. In a healthy person, which of the following will have the greatest influence on the resistance to pulmonary airflow? Come on, guys. Let's go, let's go, let's go. Yes, the answer is C. That's bronchial diameter, extremely important. So look at this question as usual, which is suddenly becoming customarily to me. This is the option, and this is the question. Which of the following is the term for the lungs' resistance to expansion? Pulmonary ventilation, pulmonary compliance, pulmonary stenosis, pulmonary surfactants, pulmonary impedance. Quickly, guys, quickly. I have 6 minutes to leave you. Come on now, only 3 people. Where are the 15 people? I don't understand. Should I call names? Want me to start calling names? I'll call names too. Uh-huh. Now you guys come now. The answer is pulmonary what? Compliance. Exactly. Now look at this question, guys. This is the option, and this is the question. The amount of air in excess of tidal volume that can be inhaled with maximum effort is the dash. We have vital capacity, we have inspiratory reserve volume, we have expiratory reserve volume, we have residual volume, and we have inspiratory capacity. The amount of air in excess of tidal volume that can be inhaled with maximum effect is the dash. Oh boy. Are you sure you guys are prepared for respiratory system? Okay. Yes. The answer is respiratory reserve volume, right? Now, you need to know what tidal volume is. Tidal volume is the normal amount of air, you move in and out in a quiet breathing. You need to know what respiratory reserve volume is. The extra air you can force into your lungs after a normal inhalation. So see me, I've inhaled normally. Do you understand? So this extra air you can force into your lungs after a normal inhalation, if you take a normal breath and then keep inhaling as deeply as possible, that additional air is what? The IRV. When you talk about expiratory reserve volume, it's just opposite. I expire. Then I go. Somebody say I'm enjoying myself. I am. Then you have the residual volume. The residual volume is this air that stays in your lung. Even after you have blow out as hard as possible. You know, it keeps the alveoli from collapsing. So, for example, I breathe in, I breathe out. I continue. I finish blowing out. There's still air there. That air is the reservoir volume. It doesn't want the lungs to collapse. All right. So you need to get this information as good as quickly as possible. So look at this question. I hope you can see the question, I believe. Yeah. So this is option. That's A. That's B. That's C. That's D. And this is E. Answer, guys. Let's see those out. You're listening. Yes, guys, the answer is let me see. Expiratory reserve volume. Yes, expiratory reserve volume plus total tidal volume plus inspiratory reserve volume. That's the answer. Yes, that's vital capacity. Right? That's vital capacity. Then look at this question, guys. Let me see. What's the answer? Quickly. No option. You guys like option too much. No option this time around. What's the answer? Deep, rapid breathing, often seen in terminal diabetes mellitus, is known as what? Yes, the answer is Kussmaul. So I have few questions to go. Look at this question. Look at this question. It's a clinical setup. You understand? This is A. Yes, the answer is Kussmaul. I don't know if that's the pronunciation, but whatever. Pronounce it. What's the pronunciation? Kus what? Kussmaul. Yes, that's the answer. That thing you pronounce. That's the pronunciation. All right. Uh-huh. So this is A. This is B. This is C. Ha, Victor. This is the first time I'm seeing you this night, too. You've been sleeping because you've not been answering. I know the names of everybody I was answering. You've not been active. And this is E. What's the option? What's the answer? Tom is respiratory arrest due to electric shock. Why does a good Samaritan have up to 4 or 5 minutes to begin CPR and save Tom's life? How many people? 1, 2. Okay, that's substantial. I forgot that people have already answered before I finish posting. Yes, the answer is B. Venous reserve of oxygen in Tom's blood. All right, that's why we're able to save Tom. This one is a giveaway. Yes, it's the venous reserve. Yes, B. All right, quickly, what's the answer to this one? Just give me the option. We are almost done. Almost. Almost. Come on, guys. Yes, the answer is 4. All right. So look at this one. What's the answer, guys? You want options? Okay, let me give you options. A is 40, 95, 74, 7.4. B is 95, 40, 7.4. C is 7.4, 40, 95. D is 95, 7.4, 40. E is 40, 7.4, 95. Yes, the answer is B, guys. The answer is B. All right. The answer is B. So I will ask you just two more questions, two last questions. Then you can go and rest. All right. So that you don't stress yourself. And these two last questions will be pathophysiology. This is the first one. Which I follow is a lung disease marked by abnormally few but large alveoli. Hold on. No. Hold on. Okay. Yeah, what's the answer to that question? You can go. What's the answer? Copulmonal, that's A. Pulmonary hemosiderosis. Then C is emphysema, atelectasis, and collapsed lung. Copulmonal, pulmonary hemosiderosis, emphysema, atelectasis, and collapsed lung. What's the answer, guys? Answer, guys. Anodia, Gabi, Jordan, Esliva, Anna. Only Victor, where are you? What's the answer? Mr. Song. Vedette is sleeping. Are you? Wake up. Wake up. Wake up. Wake up. Last question, guys. Yes, the answer is emphysema. Yes. Let me not waste time. So I know if I keep quiet now, you guys. So what's the answer to this one? This is the last question. We have asthma, we have oat cell carcinoma, we have atelectasis, we have chronic bronchitis, and we have emphysema. Tick sputum, hypersecretion, hypertrophy, asthma, oat cell carcinoma, atelectasis, chronic bronchitis, emphysema. Answer. Yes, the answer is chronic bronchitis. All right, so you need to know the differences between these things, and that's how we are going to stop respiration. We tried now, it took a lot of things, and this is almost 2 hours 41 minutes. That's fair. That's fair. So on Monday, please try to remind me on Monday, and try to remind everybody. And I need you guys to put a poll in your group to make sure that at least 20 people will be available for it. You understand? But specifically 8 o'clock Monday. Monday, yes, 8 o'clock Monday. All right. Thank you guys so much. You guys are the best. Thank you. You guys were active today. Is there a video on lymph? I don't think I made a video on lymphatic system. I don't think so. And if I promise you that I'm going to make a video between now and but I'll make a video before the end of the semester, right? Because you need it. I think you really need it. A lot of questions will come out from lymphatic system. You see, I'm behind on videos. Yeah, I've been really stressing. There are a whole lot of things. Yes, so the thing is really keeping me a lot of busy. This website that we are building now, so it's really choking me. And you guys are not telling the other classes, because a lot of them, if I meet them and ask them, oh, what's up? They say, no, nobody told them anything. You guys should tell all the other classes now. Give them I'll put the code in your WhatsApp group now. Just take the code like this, show them. That's it. They tell us, just scan immediately and do it, because we need everybody so that they will also benefit when it comes out. So everybody, please. So just the other classes, they are not, seeing the code, and it's not nice. So just I'll put it in your group so that you show them. All right. Thank you so much. Yeah. So I will see you guys tomorrow. Take care of yourself. Good night. I have to go and eat and sleep. I feel sleepy, man. Yeah, thank you so much. Thank you, Jordan. Thank you. I don't know why I like this beard so much. Like, I'm always touching it as if it is big. Ah, God knows why he didn't give me big beards. As mean I have big beards. Ah, like this, I'll be sleeping on it. I should share what? Jordan, clean your mouth. Do like this. Ah, this thing, me that is not hairy. This little one, little gift. Stop it, though. Stop it. Yes, I need a big one, like something big like this, long. But this one, this is the highest it can go before you know it start falling out. How you put shave it and now you are putting the capital letter? Please, I'll leave you before the hair sees what you are saying and start falling off. Bye. I'm ending the stream. Jordan has finally chased me away. Bye. See you guys later.